Mental health and business metric. We discussed the 3 ways to maximize mental health investment as we enter the home stretch of the pandemic. 1. Be proactive. 2. Invest in high-impact areas. 3. Prioritize leadership training. You subscribe our YouTube channel for more relevant videos. Introduction. Even prior to COVID-19, mental health was taking a big bite out of business. In 2018, the Lancet Journal of Medicine reported that mental disorders were on the rise in every country in the world and estimated that issues with mental health will cost the global economy $16 trillion by 2030. Unsurprisingly, the pandemic has only exacerbated the problem. McKinsey Company estimates that 35 million additional Americans are suffering from behavioral health issues today. My company's recent survey of software engineers confirms the trend, with 1 in 3 software engineers currently describing their mental health as fair or poor. The pandemic may be winding down, but the trauma of more than a year of isolation will almost certainly be long-lasting. Unless leaders give their teams the resources they need, productivity will suffer and retention will nosedive. Employers are in a unique position to help employees through this era of uncertainty, and businesses that invest in mental health stand to benefit the most. Mental health is no longer just a matter of personal wellness, it's now a business metric as well. Below are 3 ways to maximize mental health investment as we enter the home stretch of the pandemic. 1. Be proactive. When it comes to mental health, an ounce of prevention is worth a pound of cure. Happy employees tend to stay happy when given proper support and development opportunities. Unhappy employees, on the other hand, are much harder to reinvigorate once they've become burned out or disillusioned. Burnout among software engineers is especially common. The top burnout-related posts on Hacker News have received thousands of upvotes, and burnout stories on Reddit get significant attention as well. Undoubtedly, there are hundreds or thousands of untold stories for every one of these. The good news is that preventing burnout is one of the easiest ways an employer can boost employees' mental health. In my experience, learning and development (L&D) programs have a huge impact on employee well-being, with 58% of engineers we surveyed citing L&D programs as a must-have for success. Putting programs like this in place before burnout crops up will keep employees happy and motivated and give them someone to turn to if the going gets tough. Good mental health in the workplace doesn't just happen. It's the result of a work environment specifically built to promote happiness and well-being among employees. 2. Invest in high-impact areas. Investing in employee mental health is one of the best investments a business can make. According to a recent Deloitte study of Canadian organizations, businesses that invest in mental health programs saw a median annual ROI of CA $1.62 for every dollar spent. This number rose to $2.18 for programs that were in place for 3 or more years. And, according to a separate study, early intervention programs like crisis counseling, behavioral health screening and emotional fitness guidance can have ROIs of up to $65 for every dollar spent. Compared to other common business investments, these programs are a bargain. Targeting low-hanging fruit, like mental health care benefits and mental health treatment, can have a huge impact on a business's productivity. Robust mental health care benefits help not just current employees but also help with retention and recruiting. In fact, 26% of the engineers we surveyed ranked mental health as one of their top 3 sought-after benefits. So, do your current healthcare plans cover mental health treatment? If so, to what degree? The pandemic has ushered in a shortage of mental health care resources, so giving employees the help they need can create a competitive advantage for your business in addition to providing desperately needed help to those in need. 3. Prioritize leadership training. A whopping 92% of employees said they would be more likely to stay with their job if their bosses showed more empathy. Productivity metrics confirm this. Leaders who manage their employees with empathy see 21% higher productivity on average. This means one thing: training managers on compassionate leadership pays dividends in the realm of employee retention and productivity. Even if your management team already understands the importance of employee mental health, they might not know how to foster a healthy work environment in practice. Some tactics I've found to be particularly effective are also the hardest to measure, such as encouraging managers to show vulnerability, allowing current events to inform leadership styles, promoting work-life balance, and creating space in one-on-one conversations for more heartfelt conversations. These tactics come more naturally to some managers than others, so specifically training everybody will make sure the entire management team is equipped with the necessary skills to manage empathetically. Ignore mental health at your own risk. Neglecting to address mental health at your company can come at a steep price. Investments in mental health programs mitigate costs in the long run and not only in lost productivity. As more and more companies expand their mental health benefits to meet the demands of employees, your organization could be left at a competitive disadvantage as highly sought-after talent seeks out greener pastures that are friendlier to maintaining mental health. A quarter of U.S. workers say that the workplace is the biggest source of stress in their lives. By putting mental health at the center of your business, you'll not only improve the lives of your employees, but you'll also improve the bottom line of your business. Reference this video based on the article of Clay Kellogg, CEO at Terminal, a startup changing the way high-growth tech companies hire and retain tech talent. Clay Kellogg, Forbes Council's member, Forbes Technology Council Council Post. Membership, fee-based.